Greetings, and thank you once again for spending a few minutes with us to learn all of the things that are happening around FHN and throughout our community. Joining me today is Kathy Martinez, who is Executive Vice President for FHN and serves as our Chief Operating Officer as well as our Chief Nursing Officer. However, after the past couple of months, she's had a new role, which has been our Incident Commander. So Kathy has been at the helm coordinating our response to COVID-19. And it's my pleasure for you to be able to hear all of the great things that our team is doing from Kathy.
Beginning May 11th, the Illinois Department of Public Health is allowing healthcare organizations across the state of Illinois to resume elective surgeries and procedures. At FHN, we are now going to be able to offer services such as cardiac rehabilitation, physical therapy, elective surgery such as joint replacements, GI procedures such as screening colonoscopies that have been postponed due to the COVID-19 activity. The process for rescheduling an appointment or to make a new appointment is to call your provider's office. Our call center team is willing to accommodate you into our schedule. However, you may receive a call proactively from one of our team members to reschedule an appointment that was canceled due to COVID-19 activity. If you have a chronic disease, or have recently been discharged from the hospital or had a recent emergency room visit, it's crucially important that you do not delay further medical care. We want to be able to assist you during this time. It's important that your diseases such as COPD, heart failure, and diabetes are actively managed so that it does not result in an emergent situation. As well, prevention of disease is critically important. So please consider making your physical appointments as well as school and sports physicals during this time. The emergency room staff and providers have been undergoing various training as well as assuming new policies and procedures as we are learning more about coronavirus. We have, however, instituted many different processes to ensure your safety while you're in the emergency room, such as cleaning of room and high-touch surfaces, as well as ensuring that our staff and providers, as well as you, are isolated when presenting with symptoms such as respiratory symptoms as a cough or a sore throat. The environmental service team at FHN has truly assumed a brand new role within the organization, and they are our safety ambassadors during this time. They have implemented various procedures and processes which allow high-touch surfaces and different areas that are identified to be cleaned on a more regular basis. They use items such as our ultraviolet light to disinfect areas that have been occupied by patients that have either symptoms of respiratory or GI illness. Nurses Week always falls within the first 2 weeks of May, as it celebrates Florence Nightingale's birthday. During the COVID-19 pandemic, the nursing staff at FHN have been phenomenal. While they have been working with patients that have been within the intensive care unit, emergency room, or office practice setting, they have continued to demonstrate their respect, dignity, and compassion to each and every family member and patient. Many of the stories that I've heard have included nursing team members in full isolation gear exercising with a patient to allow them to regain strength after a long length of stay. They've held the hands of individuals who were scared because of the visitor restrictions. And they've also been able to accommodate and be with families during the last moments of their loved one's care. Our nursing vision here at FHN is nursing excellence for those we serve. And even though there's a lot of attention to healthcare workers during Nurses Week, our nurses live that vision each and every day here at FHN. I am honored and proud to be the Chief Nursing Officer for FHN, and I am so proud of our staff each and every day.
Well, it has been yet another busy week full of activity. One of the things that we've seen is a recent uptick in positive test results for COVID-19 patients. And we have seen an increase in our hospital admissions. So we've seen a few more COVID-19 patients than we have in the recent past. The good news is that we've also seen all of those patients being well treated and on the road to recovery. In fact, most of them have already gone home to be taken care of by the people that they need to be closest to, and we continually monitor them remotely to make sure they have all that they need. We're also working on getting prepared to resume a lot of the services that we had on hold over the past 6 weeks, and that includes on May 11th being able to resume with our elective surgeries and procedures. I think what's most important is for people to feel reassured that they're coming into a safe environment, and that's both physical safety and psychological safety, that we've taken a lot of steps to make sure that people are well cared for as usual, but in light of the COVID-19 outbreak, we also want them to know that it's very clean, very safe, and we are prepared taking gradual steps to reintroduce our procedures and ask them to make their appointments to follow up with their physicians that maybe they had put off during this time, and know that we are ready and able and willing to care for all of their needs. So that perfect storm has created a set of unique challenges for FHN. While we've been very busy preparing for the potential of a pandemic outbreak and seeing lots of COVID-19 positive patients, it's required a lot of training for our staff. It's required us making sure that we have a surplus of personal protective equipment, making sure that we have enough beds available for patients should they need it. And thankfully to this point we haven't seen that, but it has resulted in decreasing our normal business. So we had to cancel many appointments in our physician practices, as well as delay many elective procedures. And that's adversely impacted us in our revenue and our ability to continue our operations. One of the ways that FHN is handling this is by making sure that we're trying to contact any person that had experienced disruption in having appointments canceled or having procedures canceled, and trying to get them rescheduled and making sure they know that we're going to get them in as soon as possible. We're going to be very flexible, but at the same time we want to make sure we're taking a gradual approach because we don't want to jeopardize anybody's safety while we're doing that. What we're also doing is making sure that we have a certain amount of reserve capacity available, so a certain number of beds in the hospital available, certain number of ventilators available, certain number of personal protective equipment that we would need to have in reserves should we see a resurgence of COVID-19 patients. So we're being very judicious in how we're doing that, and we're also trying to flex our workforce as much as possible to accommodate the volume. Back to normal is probably a term that most of us won't know for quite some time. I think it's going to be more likely that we'll be in our new normal. So certainly things are going to look a little bit different, but different isn't always bad. It can be better. So we're taking additional precautions, and our world has quite simply changed, and we need to accept that and make sure that we embrace those changes, yet ensure we're able to deliver the same high quality, compassionate, excellent care that we always have. One of the best ways that the community can help its local health system is by referring friends and families to FHN, making sure that you're taking care of your own health, coming in and seeing your physician for your well-being checks, also making sure not to delay or postpone any procedures that you might need to have. We're here and we're ready to serve you, and the best thing that our community can do is to utilize our services. They can also make donations through our FHN Foundation. We have a separate COVID-19 fund that's available on our website, www.fhn.org, where people can contribute to help offset some of the adverse costs that we've experienced. But once again, for me, the highest compliment that anybody could ever give us is by referring a friend or a family member to our services. One of the best ways to stay up to date for what's happening during this COVID-19 situation is to visit our webpage on a regular basis, www.fhn.org. They can also visit our Facebook page as well, like us, and start to follow that thread, as we strive to update both of those areas on a weekly basis with interviews, videos such as these, articles, as well as making sure that we fact check any information that's being posted on those sites. We want to make sure that we're delivering the most credible information to our communities. As far as making appointments, those can be requested through My FHN, the online portal for those that are already patients, and certainly calling your provider office, and we'll do the best that we can to get you in a time that's accommodating for your schedule and also provide as much flexibility as possible. So one of the best ways to request an appointment is simply pick up the phone, call your provider, or use our secure online messaging. What I'd like to share with the community is, once again, we're all in this together, and I've appreciated the vast outpouring of support that our community has shown for all of our healthcare workers, and likewise, the way that the community has come together to see what it is that we can truly do to support one another. I would ask that we be patient as we continue to try and protect lives, make sure that we're adhering to good hygiene processes, washing our hands, making sure we're not touching our face, wearing masks when we're out in places where we can't socially distancing whenever possible. And I think what's really important is to support local businesses. So as Illinois begins to reopen and we have a great spring season ahead of us, let's try and keep all of our business local as much as possible.